This is the last for today. I will touching on I will talk regarding what we do in the Solomons regarding mosquito surveillance and control work that goes with it. Prior to 2018, malaria was the main focus of the Solomon Islands vector program activities, and the main vector we have is called anopheles variety. But then, as if fight against malaria is not enough, we got two dengue outbreaks again, 2018 and 2016. Dengue 3 in 2018 and 2016 it was dengue virus 2. And then we have another one virus disease outbreak, that was Zika virus 2015. And to make matters worse for us, during the surveys in 2013, we discovered that Egypt has again re-established in the Solomon Islands, especially in Honiara, after 35 years absence. And in the Solomon Islands, both the vectors of the virus, that's Egyptia and Arabictus, they are present there. So what we try to do in the vector-borne program, disease control program, is we use our surveillance to just to get information on the high-risk sites or provinces in the country, and then when there's an increase in those IWS disease, we sort of use that to direct our vector control interventions. The surveillance methods used in malaria, the main ones are level surveys. That's we go into where we suspect where the malaria vectors sort of have the habitat, and then do level surveys. And then a common one we always use back home is human landing cuts. That's usually down in the night. That's from 5:30 in the evening to 9 o'clock in the night. That's what we call is the big biting times of the malaria vector. And then from time to time, we try to use the CDC light traps. And then I'll come to that later on how it goes. CDC light traps when we use it back home. For dengue vector surveillance, the method we use mainly are level surveys. Then we tried from last time we used guts, and then this last time we got the stuff from PacMOSSI. We tried to use the BG, and then occasionally we use strip nets. Those are three main ones. And the vector point activities we use is for malaria vector control work interventions. In the Solomon Islands, we distribute free bed nets to everybody. Like in the latest distribution was in 2021, I think, 21, 22, and we distributed about 200,000 nets, bed nets, free ones. And then another vector control intervention we just come back again last year, is indoor reservoir spraying of houses. We stopped doing that in 2015, but the last year the Global Fund gave us some insecticides to redo it again. And so the information is, I think, last year we sprayed about 50,000 houses. And unlike bed nets, indoor reservoir spraying is only done in selected provinces. That's in provinces where they have high malaria cases. And for dengue work, the activities we usually do is we do fogging out on resting places outside, and then ULV spraying. Just for information, we don't do this regularly, but it's when cases come up, and then we identify where the dengue-like cases are from. So that's when we get information from the clinics, and we go and do this one. And there you can see Mr. Blower machine we used there. That's an old one, but thankfully to PacMOSSI, we got two new ones for last year, I think. And thanks to DFAT for that let-go ULV machine, but we got that in 2015 or 16, I think. This is still working. And we only use these methods or interventions when we have huge gatherings. A good example was last year when Solomon Islands we hosted the PacMOSSI Games. We do a sort of preventive treatment of where the participants sleep and the sports stadium. And that was in general cleanup by the general public was also done. And that assisted us. And lucky for us, I think there was no outbreak during the gathering. And some outcomes from the methods we use for the development for the malaria work, like level surveys, we always done them in sentinel sites. Like the challenge is that some places the level surveys do work, but in others we can't collect anything, any vectors, larvae. But the one thing about level surveys is that you have to know when to do it. During the rainy season or after rainy season, you don't do that because usually the water washes away the larvae. And then for human landing cats, that's when we collect the adult ones. Same as the larval surveys. It works in some sites, but not others. But usually the larval surveys and human landing cats are also done when we do surveillance, and then those mosquitoes we collected are also used for insecticide resistance monitoring. So for the larvae, we sort of read them to adults and test them. For the adults collected in the HLC, we also test them. So that's sort of doing two jobs at the same time. For the CDC light trap, we try to use it, but it doesn't work. We try to modify it with a source of carbon dioxide. So we use homebrew yeast plus sugar. That's a source of carbon dioxide. We use it with the CDC, but there's no improvement. We didn't get any malaria vector. We only got Culex, the main one. Despite the huge distribution of bait nets over the years, the impact has been it's not too good, not promising. If you look at the graph over here, that's for another city, one of the hotspots for malaria transmission. The blue one is so clear. That's for the overall one for Manila City Council. So even though we give out bed nets or we do IRS, but the case is still going on. But the thing is that this is done for a whole year. If you monitor, sorry. Hello?
Let's press and hold. There you go.
Like the bar graphs over here are done over, that represent a full year, but if you do them over a monthly period, like you can see peaks or when it drops during a certain month, and it's usually after you do those interventions, like giving out bed nets or spraying houses, you can see a short drop, small drop, but then after that, it sort of rises again. So the interventions we use for malaria in Solomon Islands are still on a question mark whether they're working or not. But there are some factors that contribute to this one. With the dengue work we do is that the level surveys, like we've done that, like the method we use is that it was done throughout the whole country. That's usually gives us the information on what species are available, they are present there. But then it was through level surveys that we find Egyptia when it's the first time we got it. And then, but the main disadvantage of level surveys are they are pretty expensive to do, as it involves a number of people. And then in Solomon Islands, we don't have a good space, working space to work in. So that's one disadvantage of it. With the cat traps and the BG and the sweep nets, they're all effective in collecting the vectors. But for Solomon Islands, one disadvantage of BG traps is if you use electric, I think Solomon Islands got the most expensive electric cost in the whole Pacific, I think. So To avoid that, we have to use big batteries, which are pretty heavy to carry, but they have to last 24 hours. For guts, they do work, but we need to find a sort of substance that can use part of the translucent component of the guts. For sweep nets, like it's a timing of when you have to do collection of the vectors using that method. Like sometimes it's early in the morning or in the evening, and then some property owners might not be too pleased to seeing you around the area at the time, and then to do it, and also manpower is a sort of hindrance we face from time to time. But one method that we try to use is we train people from the house. We're gonna try to do that, implement a sweep net collection, is to train them and let them do the collection for us. At the time, with that arrangement, the property owners might accept to do that work in the area. I think one factor that's been helping us a lot is the involvement of general public in source reduction activities. Like in most of the provincial centers, which in Solomon Islands we don't have this insecticide for dengue work available for us. So whenever there's reports of increase in dengue cases, usually the whole town or provincial town, the premier or the mayor would ask people to do cleanup. So that sort of help us out in some of the provinces. Some things to address probably for us is now we can see that bed nets and IRS are not that effective for us. Like the cases have been on the rise. One thing we've been talking about, like discussing, is trying to field test an intervention that addresses the level or the people stage of the vector in the habitats. And then, because one thing about this malaria vector in Solomon Islands is you use bed nets to sleep under the night, but the vector doesn't bite in the night when you sleep. They always bite outside when people are awake, and it's normal for us, usual for us Pacific Islanders. Every time we spend the evening telling stories outside, so that's why most times the malaria infection or transmission occurs. And another thing to address is for vector surveillance, but probably need some effective traps to collect the vectors for surveillance. For dengue, we're trying to, I think for us Solomon Islands, I think the most expensive, I think the most affordable one for us is the gut trap. So at the moment we're doing work on trying to work on the ways we can modify that one. We are using a lure, just a local arable grass, and then the treatment of the inside of the trap, where the mosquitoes, the vectors can get stuck on it, whether we use grease or insecticide. But the thing with if we use insecticide for this collection is, just to overcome resistance, we have to use a insecticide that has synergist in it to overcome possible resistance. For malaria vector collection surveillance, probably we should continue HLC or level surveys. And then community participation is something that I think what we have to rely on most at the moment and has to be encouraged. And then one problem we always have when in a dengue outbreak is timely reporting or sharing of information from the clinics and the information of where the cases are. It's one thing we have to overcome at the moment. And I think one solution for that is to make dengue a notifiable disease in the country. If we make that one, I think the nurses or the health facility workers will take it as priority to share this information on time with us. And the difficulty we have at the time is, at the moment now, is access to insecticides during an outbreak. Like in the past, like dengue work in Solomon Islands was supported by DVAT, but then when they pull out, so we have to, during an outbreak, we have to procure medicine, insecticides, but it takes a lot of time to get the processes going, to get insecticide. And by the time the outbreaks already it's already fully blown. And then for the IRS, we in Solomon, when we ordered insecticides through our donor, our stakeholder, we requested long-lasting efficacy insecticides. But then in the end, like the one that efficacy or effectiveness lasts for 6 to 9 months. But when they bought us the one for us, the one we used last year, Bendiocab, they only bought us the one that only has a efficacy of 3 months. So probably might be that one cause of the cases increasing after we did. The IRS doesn't last very long when we did it, when we implemented it last year. And then another one major request we have for any assistance at the moment is an insectary where we can do all this lab work for vector control work in Solomon Islands. At the moment, we don't have that one, so when we go to our provinces, we should do them in their labs where it's not an insectary, but just a clean lab or one room in the provinces. The summary of our key points for presentation. Most of the vector control intervention implemented in the malaria program in Solomon Island is now doing it. So having the impacts, expected impacts, you have to rule upon that. Information on the local vector behavior must be considered by stakeholders when you make the decision to assist us. Like when we had a discussion with a current stakeholder who supported us in the malaria work, I'm not going to give a name. We always quote this study done by a team led by Professor Tom Beckott when they do the work in Gela regarding the biting behavior of the malaria vector in Solomon's. But when every time we try to talk about that, and it seems that we are just shouting the desert, nobody takes note of it. Then for dengue work in Solomon Island, I think we believe that we should be given the same attention like malaria work. Like at the moment, most of the funding and sources come in is all for malaria. For dengue, sometimes when we want to do dengue work, we have to piggyback on some activities that we do for malaria. And then the problem we had is to talk about is time implementation of vector control interventions. Like we want to do it usually before peak times of transmission, but processes and procedures in the country make us unable to do that. So usually we implement these interventions, it's way past the peak period and transmission is already okay. And then the last part is whatever interventions or methods we use, it must be effective and at the same time sustainable for us and easy for us to handle, to use. Colleagues, I think that's my short presentation for today. Thank you very much.